Vaccination rates vary a little bit by country, and recommendations vary also a little bit by country, but most countries adopt a policy that vaccination is recommended to be given between 9 and 12 years old, so before young adolescents become sexually active, and this is the policy that has been adopted in most countries in the Western world. We do see that adoption of vaccination is poor in certain groups, such as working age men, for example, and there's a lot of work needed in terms of education and public awareness of HPV to get these vaccination rates up. But vaccination does help prevent HPV-driven cancers. We now are starting to see the effects of vaccination on cervical cancer in women, and because this cancer occurs at a much younger age than other HPV-driven cancers. So cervical cancer occurs with a peak incidence at 40 years of age. So girls that were vaccinated since 2006, we already see a lower rate of these cancers arising, which is good. But for head and neck and penile and anorectal cancers, the peak incidence is much later in life. So we don't see these effects yet. And the next 2 generations will still be facing a lot of patients with HPV-driven cancers in the penis, in the head and neck region, and also in the anorectal region.